Good afternoon, everybody. I've been a dental assistant now for 3 decades, working in the public and the private sector. I've worked primarily within the dental hospital during my 20 years of service for DHSV. I returned to study after 21 years of not studying, and then completed my certificate in training and assessing, and also my passion, which has actually turned out to be a certificate in oral health promotion. I currently work in the primary care general practice department. As you can see here, we've got a framework that we actually work by here within the framework of DHSV. This structure has allowed us to actually work within and find ways to actually work and predominantly work within and identify different types of scopes of practice. I lost it there. But more on that later. After completing my certificate my job really didn't have any real structure to it. I was still a dental assistant and passionately worked within that scope. But then, little by little, in an ad hoc fashion, on prescription by operators, I then started to do a little bit more. In 2014, off I went to do some asylum seeker triage sessions. I then took a journey downtown to the actual homeless drop-in centre. I then started working primarily with our therapists and hygienists in a tandem working approach. And in 2016, the oral health promotion appointments became a reality. After the asylum seekers are released from detention, 4 to 5 days later, they actually participate in a health triage. This is run by RNs, and there has been no real way to actually assess the dental issues for these people. So I became involved to allow for a realistic and also a referral proper working with the RNs for dental triage. I would also provide dental education for these individuals as they've moved into a Western society where there is a very hard reality slap in the face for them, where we have a high sugar contents, low cost foods and drinks, and their dental issues skyrocket. I would then, for 4 hours each month, I would set off on a journey down into the Melbourne's very own Hosier Lane. This is one of the most colourful places in Melbourne, and that's not just for the graffiti. It is the home of a drop-in homeless shelter. You can see there, just past the lovely heart person, there's a little door, and that's actually the front door. These individuals have a primary health source here. This means that people that are homeless or at risk of homelessness actually have a way to receive primary health care. So I set up shop during one of their drop-in timeframes. For 4 hours a month, I would perform dental triage and allow for appropriate referrals to be given to these individuals to RDHM. So nobody knew of their homeless status. I would also perform a dental education for these individuals, specifically designed around homelessness. Mind you, this is extremely different to what we see even in our primary care facilities and also in our general practice environments. This is the coalface. In 2015, as I said, my dental assisting took a tiny deviation off the side. I started working primarily with the oral therapists and hygienists. So I would do my chairside assisting and all that entails, but around about a half of those individuals that had appointments with these ladies would need a little bit extra. So the girls would then hand over the reins to me. I would be reintroduced to the individuals, identifying my role as an oral health promoter. Then I would set out to work with the individual. However, time is of a constraint because I'm using the oral therapist and hygienist's appointment. So mostly specific treatments are applied and a real concentration on oral hygiene instruction. The big day arrived. February 2016. The DA cert for diary was open for business. We're starting out with 1 day a week, with more to follow, fingers crossed. Our patients receive 2 45-minute appointments with around about 3 weeks in between. Or it might be just a 1 30-minute appointment for those patients that have had a general anaesthetic, predominantly for their parents. During these appointments, the patient and I would sit down and do an investigation to find out what they understand about their own dental health. Because one size does not fit everybody. So I work towards making them accountable for their own dental health and what they can do in the long-term results of their own dental issues. Oops. So our treatment flow has slightly changed, or it's still in its infancy. We now weave in the oral health promotion and education in amongst the other appointments that the patients actually receive. The dentist, of course, sees them, a therapist or hygienist, depending on their issues. Then they come and see me. They have the best entertainment they could possibly ever have. They go back to see the dentist, and then, if they require, moving on to prosthetists and specialist treatment. So what is oral health? Where do I start? What does the patient really bring in the front door? Wow, they've got poor oral health, poor cleaning methods, poor oral hygiene, low water intake, high sugar intake, and just do not get me started about the energy drinks in bottles. Unbelievable. I have a philosophy when it comes down to education. If you don't know any better, you can't do any better. So it's all about making sure that the individual has the right tools so that they can move forward. And that's where I come in. As you've already heard some of my colleagues say, we do a saliva test, a plaque index, dietary analysis, and most of all, the oral hygiene strategies. I'll say it again. One size does not fit everybody. This is a gentleman that has always sat in my mind. He was one of my first clients that I saw as a patient, as a one-on-one appointment. Now, this is in his words. I haven't brushed my teeth for 35 years. I use a bit of salt mouthwater rinse. I use a packet of chewing gum every day. Oh, I use that stuff called, what is it called? Listerine. So I then had to sit about and find out what his trigger is. What was actually going to make him motivated to actually change his resolve? So I learnt a lot about tattooing within a very short period of time because he had a passion for tattoos, as he's a tattoo artist. His oral hygiene was absolutely pathetic. His halitosis, oh my goodness, I think I wanted 4 showers that night. But like I said, I learnt a lot about his art form. So I could then redevelop and reissue the information I needed to give him back in his own words. So how does he work with irritations on the skin? How does he work with blemishes? How does he work with birthmarks? The penny dropped. Oh my goodness. His passion for tattooing allowed me to get inside and work out how we're going to teach him how to do this stuff. Also, who'd want to sit next to somebody having a nice tattoo or sleeve done when they've got a smelly breath and also their mouth is atrocious? When I saw him about 6 weeks later, because he deferred his appointment, of course, the first thing he said to me was, "Julie, I have had return clients." Does it show? He goes, "Oh my goodness, I've actually finished a full upper sleeve. I can't believe the work that I've actually put into this. I've spent 16 hours working on this young guy, and not once did he want to leave." To me, that means everything. Being able to change a person who honestly said he never brushed his teeth to now being a twice-a-day habit person, every day. Mind you, he didn't like my idea when I said, "Perhaps a percentage of your takings for your clients?" He said, "No, but you can come in any day you want." I was like, I think I'll give it a miss. This brings me to the framework of DHSV and the guide to developing a model of care. We're not quite there yet within the confines of primary care and general practice at RDHM, but we are on the road. We're looking at redeveloping the way that the patient receives their general dental care and the treatment flow, which is patient-centred, multidisciplinary and collaborative, cost-effective, and of course, preventative. It's all about the right patient being treated by the right person at the right time. I thank you kindly for your time.